Excellencies, ladies and gentlemen, during today's opening ceremony, we'll have the pleasure of hearing from His Excellency John Dramani Mahama, His Excellency Mahmoud Ali Yusuf, and His Excellency Evariste Ndayishimiye. Excellencies, ladies and gentlemen, now I have the immense honor of inviting His Excellency John Dramani Mahama, President of the Republic of Ghana and African Union Champion on Financial Institutions, to kindly deliver his opening remarks. Excellency, please, you have the floor.
Thank you very much. Excellencies, heads of state and government, distinguished guests, ladies and gentlemen, let me proceed on the established protocol. On behalf of the government and the good people of the Republic of Ghana, I bid you welcome in the most special way, and as we say in Ghana, we say akwaba, which means welcome. You've come to a city that knows something about great beginnings. In December 1958, our first president, Osagyefo Dr. Kwame Nkrumah, gathered the freedom movements of this continent here in Africa at the All-African People's Conference and reminded them that the independence of Ghana would be meaningless unless it was linked to the total liberation of the African continent. 68 years on, Excellencies, you've returned to Accra at another consequential moment. The fight for liberation today is against another kind of oppressor, one that is more subtle, yet no less dangerous. It is the fight against inequality, a fight against oppression of viral diseases, of mothers forced to bury their children, of children denied even a single moment of the innocent joy of a mother's smile. It's liberation from this oppression, Excellencies. Liberation from this oppression, Excellencies, shall be measured in the clinics that stay open in our countries, in the medicines that are manufactured on African soil, in mothers cuddling joyful infants, and in financial budgets adorned with the numbers of our own choosing. We've gathered here because we are the front line of this liberation struggle. We are the generals of the continent's battalion of change seekers. I thank the chairperson of the union, the chairperson of the commission, and Commissioner Amachung and her tireless team for the confidence placed in Ghana to lay the groundwork for this campaign to strengthen health systems and combat maternal mortality, infectious diseases, and non-communicable diseases. Some will ask, what is truly extraordinary about this session, given that our union meets regularly to discuss many similarly weighty matters? The answer, respectfully, is that the hour itself is extraordinary. By our own decisions in Addis Ababa, this assembly requested a fully costed continental roadmap to 2030 and beyond. We adopted it in February 2025 and directed that we convene to drive its implementation. That mandate would have been reason enough, but surely not extraordinary. World affairs today have, however, conspired to dramatize the situation. Development assistance for health fell more than 1/5 in a single year, from around 49.6 billion to about 39.1 billion. And so on average, significant numbers of our member states still finance roughly half of their health budgets from external sources. The temptation is to reach for words like crisis, catastrophe, maybe even apocalypse. But our duty today is to urge us to seek other acceptable language, words of urgency, no less, but of a different spirit. Let us not dress despair in the robes of earnestness. We should not succumb to panic and call it vigilance. After all, the system that is crumbling today was merely the scaffolding on the building. No one building, something enduring, a monument their descendants will be proud of, spends their time stuck on the scaffolding. Who bemoans the discarding and dismantling of the scaffolding? It is always the tower that we must uphold. Our eyes should remain fixed on that towering edifice of African liberation. The question haunting this meeting today is simple. Are we builders of towers, or we are merely erectors of scaffolds? Excellencies, I want us to examine the books together. Our continent is still home to 2/3 of the 40 million people living with HIV worldwide. A true tragedy. But the more encouraging fact is that AIDS-related deaths have fallen by nearly 3/4 since their peak. Right there is the proof we need that when we rise to the occasion, our problems will crumble at our feet. On tuberculosis, I often hear that 17 of the world's 30 highest burden countries remain in Africa. What I don't hear as often is that the incidence is down by 28% and deaths are down 46% in under 1 decade. On malaria, not a month passes without a new song being composed about how the continent still bears around 95% of the world's cases and deaths, most of them children under 5. And the tune grows even more mournful when we are told that the changing climate escorts the mosquitoes into highlands that were once malaria-free. We can go on and on from one beat of gloom to another. For example, more than 90 million of our people live with chronic hepatitis B or C, most of them undiagnosed. Neglected tropical diseases still blind, disfigure, and stigmatize our people. And if you're observant, you'll notice that most accounts of the global infectious disease burden present a uniquely depressing African perspective. But the truth is that the face of diseases is changing on our continent. We're steadily converging with the rest of the world in the types of ailments that inflict the most harm on our people. Non-communicable diseases already claim over 2 million of our people before their 70th birthday each year. Cervical cancer alone kills more than 80,000 African women each year. Mental ill health is heavily undercounted in nearly every national plan on the continent. And so what does this really mean? It means that the days when colonial tropical medicine could cast a continent as uniquely benighted and in need of missionary kind of episodic interventions are over. Africa now stands at a crossroads, defined by its appetite for total health transformation. It can no longer allow itself to be perched on the periphery and cast as the destitute beneficiary of the largesse of some distant global health systems. If we allow these stereotypes to persist, a new wave of health conditions will dominate mortality in Africa by the middle of the century, taxing our demographic dividend before it is ever paid. And that is why the Presidential Council of the Accra Reset convened a high-level panel on reform of the global health architecture and governance to consider a root, stem, and branch transformation of the mindsets, policies, programs, and systems that define global public health today. That meeting took place in Dakar, Senegal. But we're not by this action delegating our agency to any notion of an abstract global health hierarchy. While the high-level panel is independent, we have been emphatic that we don't want another list of lamentations. We have no plan to go around employing others for salvation. What we want is ideas that put the global south, the global majority, and our African family firmly in the driving seat of our own health destinies. And that is why the panel's normative and intellectual work is harnessed to the Health Investment National Gateway Enablers, in short, HINGE, and the Reform Interlock Observatory, RIO, platforms we are also building within the Accra Reset movement. We must build sockets at home to connect public initiatives with private investment and unblock barriers in the way of turning health from being a fiscal sink into an economic multiplier. Here in Ghana, we have created a whole new set of anchors for the regional harnesses that I've just described. These include the Ghana Medical Trust Fund, which Ghanaians with their customary sense of humor have christened Mahama Cares, Through these instruments, we are shielding families from the ruinous cost of chronic diseases. I'm proud to observe, Excellencies, that many of you are taking similarly bold steps in your own countries. Regarding our mothers and newborns, I wish to express my strongest personal support for President Samia Suluhu, our AU champion for maternal and child health, and to inform the Assembly that through Accra Reset, we hope to work very closely together on the Mother Africa call to action. This is the continent's first charter in support of the African Union's roadmap on maternal and child survival, which is built around measurable objectives and a clear set of reform principles. I therefore urge that we carry the same sense of ambition into each and every one of our deliberations, nor should we, even as we aim high, forget those of our brothers and sisters who are at the lowest ebb of life, those in conflict areas and internally displaced persons, where clinics have been razed to rubble and cold chains have become heaps of broken containers. The sovereign health agenda that is guiding our step as we march out of dependence will ring hollow if we cannot reach every corner of our continent. We cannot have the fog of war in the beautiful Congo Basin cloud the spread of Ebola on the delightful banks of the Nile. By now, we've all heard that Africa imports around 70% of its medicines, more than 90% of its medical devices, and over 99% of its vaccines. We all remember standing in the queue in 2021, cash in hand, watching others served first as the panic of COVID-19 threatened to overwhelm the world. We learned a bitter lesson, and thank God we have learned from it. Today, it gives me great pride to see vaccines flowing from Dakar, to see messenger RNA sciences being catapulted from Cape Town, to see the head of Ghana's brand new vaccine institute go toe-to-toe with biotech strategists around the world, to hear the new facility for cutting-edge biologicals humming on the streets of Kigali. Excellencies, we are the generals of the Army of African Health Transformation. Allow me to announce for your hearing pleasure that the pharmaceutical manufacturing plan for Africa is no longer a mere scribble on paper. The African Medicine Agencies under Dr. Mimi Darko is moving from treaty to working instruments, and the strategic joint procurement and a continental active pharmaceutical ingredient strategy will give our manufacturers the boost they have been waiting for and they so long deserve. We know very well that health value chains mean factories, laboratories, and dignified work for our young people. Sewn together by the African Continental Free Trade Area, sovereignty in health, it turns out, is also an industrial policy, a structural transformational agent, and a liberation strategy. 25 years ago in Abuja, we promised to devote 15% of our national budgets to health. That promise is now old enough to have children of its own. So the pledges we make this afternoon must be physical, not lyrical. Through the African Leadership Meeting commitments and the Program for Financing and Investing in African Health, through debt for health arrangements, solidarity instruments, and protected budget lines that survive electoral cycles, let each of us bring the Ministry of Finance to the health table and keep it seated right at that table. Prevention repays us ninefold. Show me a better bond in the economy market than prevention. Excellencies, this afternoon, we shall deliberate amongst ourselves on local manufacturing, financing, and governance and leadership. Our member states will pledge, and we shall adopt the Accra Declaration. As your host and your brother, I make one request of all of us. Let us not adopt another eloquent text. Let us seal our pacts with our words of honor. The declaration establishes a continental monitoring, reporting, and accountability framework, which we hope to align with Accra Reset's framework. We commit to an annual scorecard to be regularly brought to this very assembly for peer review amongst us. And I ask that we embrace that scorecard as the mark of a union that has grown confident enough to grade itself. We are no longer under colonial adult supervision. Our elders in Ghana say, Tekro enko ejina. It means one head does not hold counsel with itself. And that is why the founders gave us an assembly, and why you have honored Ghana by bringing this council to Accra. Many of the people we serve will not get to read our declaration, but they must feel it. They must feel it in stock shelves. They must feel it in efficient clinics, in running taps, in punctual diagnosis. They must feel it in mother and child poses for cameras with a smile and pride welling in their chest, that they have been well looked after. Let the record show that when the old uncertainties fell away, the leaders of Africa met in Accra and once more plotted our continent's total liberation from the plagues of oppression and prejudice. Let me welcome you once again, Excellencies, to Ghana. Ghana is your home. This is Africa's day, and I leave you with the immortal words of our first president again, Kwame Nkrumah. And he said, think like people of action and act like people of thought. I thank you. Asante sana, medawase.
Thank you, Your Excellency. And now